Diane. Yeah, I have to sit in this wheelchair and most of the time, I am uncomfortable in it. I try to not get mad at the occupational therapist because it is not really his fault that he has an overload of work to take care of. I have challenges with my power chair right now. It had broken. Although our occupational therapist at our house has now is too busy to come over and look at my power chair. In fact, I am supposed to start working on getting a new power chair next month.
The best thing for providers to know about this population is they're complicated. They know that. You need to look further. Just when you hear hooves does not mean horses. That could be something else. You need to dig deeper. The thing is, it's not just a, patch up and fix job sometimes. You really need to get to know and look at the guy's history. That's very important, especially with this population.
Yeah, she likes to get her nails done too, as you can see from her nail. She likes to get her nails done. So one of the girls here does her nails for her. She likes getting her nails done. She just got her hair done, got it colored. She likes those kind of things.
And we rely heavily on parents that are involved. They know a lot of their history as well.
The one thing about dealing with the actual providers is establishing enough of a relationship with them so that they know you. And I learned early on that you don't always get everything with the provider. We went to the orthopedic doctor in the nation who happened to be here. And we're still in that early phase of what's going on, what's happening. And he walked in, he sees about probably 15 kids an hour, and went through this whole rigmarole and then said, well, let's just wait and see if he's a walker. Okay, so you're looking at me and you're telling me my child's not gonna walk? And, where's that coming from? So, not necessarily the touchy-feely that you were really looking for at that point.
My name is Markia Carter. I am 34 years old. Wow, I'm old. I have 2 brothers and 1 sister. My life wasn't easy growing up. As I grew, my mom taught me from right and wrong, the normal stuff. Whatever teenagers go through, I went through just in a different way. Going from in and out of doctor's offices from when I was younger, not knowing if I would survive having cerebral palsy, because not a lot of people live to be 34. So I'm good. My favorite surgery was my hamstring surgery because the doctor that did my surgery, he was my favorite doctor. And when I had to go into the operating room, he would always let my mom come in the room with me until I fall asleep, and then she would leave. So I didn't have any fear.
My name is Rogério. I'm from Brazil. I like the drawing. Yeah, it's like Mario, like in 3D, in Mario the picture art, like the video game art. Sometimes my mom starts for me, sometimes. And my mom uses translation. Doctors know about me because I have too much pain in my legs. Sometimes I go over there for check I'm good, and everything is I'm good, Good doctors is someone like is giving attention for you, everything you want, like that.
This is where it all began, in this room.
It started out that just a personal interview with the Movement Disorder Center.
Before he was diagnosed with Parkinson's, he had the disabilities, but we were working with that for a number of years now. It took a long time for a diagnosis.
Oh, wow.
He had a lot of testing, didn't you?
Yeah.
A lot of testing.
EKGs.
You know, it took a long time to find out, but once you started the medication,
Yeah.
and the doctor knew you really well by then, things
Yeah.
have been positive, haven't they?
Yeah.
Yeah. We had many trips living in Schoharie, driving in and out of Albany or Schenectady for appointments. I think that was one of our challenges because it was distance.
Yeah.
But it has worked. There were times that seemed a struggle, but we always worked through them.
You know what that means?
Elizabeth, at the age of 3, had was diagnosed with a brain tumor. We ended up at NYU and had a good surgeon who was able to resect the tumor. And then a few months later, we noticed an aberrant giggle, and it turned out she has gelastic seizures, very difficult to control. We get good care. We have people who care a lot about her here in the center and make it their point to bring her out and make her be the best that she is. I think that's something that's very important, and it's very meaningful for us because it's difficult. She's not your typical kid.
My doctors are nice, take good care of me, and they try and get my seizures to go away.
That's right, they do.
That's good.
Young people with communication delays or inability to process information, it's often hard to communicate with them, to figure out what's really going on in their bodies. So I think from a healthcare perspective, it's a balancing act. How do you get that input and information to make a good diagnosis without over-treating or over-testing the young person?
Don't be scared, because we're all human. We're just born in a different way. We still bleed red. We still have oxygen in our lungs. We're just human. Don't treat us any differently.